Top urologist warns, never make these 3 simple mistakes that could lead to permanent damage. Hello. Before we begin, please remember that this video is for educational purposes only and is not a substitute for personal medical advice from your own physician. All right, gentlemen, let's be honest for a moment. Have you noticed that things just don't feel the same as they used to? Maybe a little more discomfort, maybe a little less sensation. It's a quiet concern, one that many men over 60 share but rarely talk about, even with their doctors. Most men just chalk it up to getting older and assume it's an inevitable decline. But what if I told you it's often not age itself, but rather a few specific outdated habits from your youth that are now causing the problem? In my field, urological research from top-tier institutions like the Cleveland Clinic consistently shows this. Age-related changes in tissue elasticity and natural lubrication make our bodies far more susceptible to injury from friction and pressure. Simple as that. I remember a patient, let's call him Robert, 68 years old. He came to my office genuinely thinking his days of intimacy were over because of persistent discomfort. He was frustrated and felt like he was losing a part of himself, but his issue wasn't his age. It was a simple, correctable mistake. I'm Dr. Audrey Wells, and in the next few minutes I'm going to reveal the 3 most dangerous mistakes I see men make after 60. I will give you the simple, science-backed alternatives to ensure your sexual health remains comfortable and fulfilling for years to come. This is about protecting your well-being and your independence. All right, let's dive right into the first big mistake I observe. This is, without a doubt, the most common and thankfully the easiest to fix. Mistake number 1, not using enough, or perhaps not even the right kind, of lubrication. Now, I want you to listen closely to what I'm about to say, because for many men, especially from a generation that valued stoicism and grit, the very idea of needing lubricant can feel, well, unnecessary. It can even feel like a sign of weakness. I've had men in my office, good men in their 60s and 70s, who almost whisper it. They say, "Doc, I've never needed it before in my entire life. Why would I start now?" And I understand that sentiment. I truly do. That mindset is a holdover from your younger years. It's a dangerous holdover. The body you have today at 60, 70, or even 80 is not the same body you had at 25. And respecting that change is the first step toward lifelong health and comfort. Ignoring it is where the trouble begins. So, why is this so critically important now? Let's talk about the science behind it in simple terms. As we age, 2 primary things happen to our skin, and this includes the very sensitive penile tissue. First, our skin naturally produces less collagen and elastin. These are the proteins that keep it plump, resilient, and elastic. This means the skin becomes thinner, more delicate, and less able to handle friction without irritation or damage. Second, and just as important, our bodies naturally produce less moisture. This is a normal part of the aging process, just like our hair turning gray. The pre-ejaculate fluid, which provides some natural lubrication, often decreases in volume. When you combine thinner, more delicate skin with a significant reduction in natural glide, you create a perfect storm for friction. And without a proper buffer, you are essentially rubbing sensitive skin against skin, creating something my colleagues and I refer to as microscopic tears. Micro tears. You may not even feel them happening. There might be no immediate, sharp pain, but they are happening. And these tiny, unnoticed injuries, when repeated over weeks, months, and years, can accumulate into a much more serious problem. And this isn't just a theory. This is something we see in clinical practice. Urological case studies, often reviewed in publications like the Journal of Sexual Medicine, have directly linked this kind of repeated low-level trauma to an increased risk for a condition called Peyronie's disease. Peyronie's disease is the development of fibrous scar tissue inside the penis. This scar tissue is the body's response to repeated injury. It's like a tiny internal scab that doesn't go away. This plaque, this scar tissue, can cause a significant and often painful curvature when erect. In some cases, it can make intimacy difficult or even impossible. While the exact cause of Peyronie's can be complex, trauma and injury are universally recognized as major contributing factors. Those innocent-seeming micro-tears are exactly that kind of injury. To put it simply, think of it like this. Imagine running a car engine without oil. For a short time, you might not notice anything wrong. The engine still runs, but inside metal is grinding against metal, creating intense heat and friction, and causing serious long-term wear and tear on the most important parts. Eventually, that engine will seize up. That is what you are risking when you ignore the need for lubrication. You are causing slow, cumulative damage to one of your body's most delicate systems. So how do we fix this? The solution is simple, affordable, and incredibly effective. You must make it a non-negotiable habit to use a high-quality lubricant. Let's break down the main types so you can make an informed choice. First, you have water-based lubricants. These are the most common and are fantastic for most men. Their biggest advantage is that they are completely safe to use with anything, and they are incredibly easy to clean up with just a little water. They feel very natural. The only downside is that they can dry out a bit more quickly, so you may need to reapply during a longer session. Second, there are silicone-based lubricants. These are a great option for men with particularly dry or sensitive skin. The molecules in silicone are larger, so they sit on top of the skin and create an incredibly slick, long-lasting glide. A little goes a very long way. The main things to remember are that they aren't compatible with silicone sex toys, and they require soap and water to clean up properly. And finally, you have oil-based lubricants. I generally advise most men to stay away from these. Things like mineral oil or petroleum jelly can degrade latex condoms, and they can be very difficult to wash off, potentially trapping bacteria against the skin and increasing the risk of irritation or infection. So my medical advice is to choose either a good water-based or silicone-based product. You can find a quality bottle for $10 to $15 at any pharmacy or discreetly online. When you use it, be generous. Warm a little in your hands first. Apply it before you start, and don't hesitate to reapply as often as you need to. Think of it not as a crutch, but as essential maintenance, true protection for your body. Remember Robert, the 68-year-old patient I mentioned in the beginning? He was the one who was so frustrated by the discomfort he was experiencing. He told me, "Doc, I just feel raw. It's not enjoyable anymore." He was convinced it was a sign of some serious, underlying disease. After our consultation, he went out and bought a simple $10 bottle of water-based lubricant. He told me later it felt a little strange at first, simply because it was a new habit. But within 2 weeks, his discomfort had completely vanished. Vanished. The synergy here is powerful. When you solve the friction problem, you create a foundation of safety and comfort. This simple act allows you to then focus on the next critical piece of the puzzle, which we'll discuss in a moment. If this is the first time you've really thought about lubrication this way, if you've learned something new and valuable just now, I want you to do something. Go to the comments section and just type the word glide. It's a simple way to acknowledge this information and help break the stigma for the other men watching. All right. Now that we've established the absolute necessity of proper lubrication, let's move on to the second dangerous mistake. This one, honestly, often goes hand in hand with the first, and it's a habit that can be much harder to break because for many men, it's been ingrained for decades. Mistake number 2 is using excessive force or an overly aggressive technique. In my practice, I sometimes refer to this as the death grip. Now, this is a learned behavior, and it's one that likely started when you were a teenager or a young man. Back then, your body was flooded with hormones. Your tissues were incredibly resilient, and your nerves were highly responsive. In those years, it often seemed like more pressure, a firmer grip, and a faster pace led to a quicker, more intense result. And so, the brain learned a simple equation: force equals pleasure. For years, maybe even decades, that equation seemed to work. But after 60, that approach becomes profoundly counterproductive. Worse, it becomes potentially harmful. The mindset of more is better is a fallacy that can lead to genuine physical problems and, ironically, a significant decrease in the very pleasure you're seeking. Continuing to apply the same level of force you used at 20 is like trying to drive a classic vintage car the same way you'd drive a brand new pickup truck. You have to respect the machinery. You have to handle it with more care. So, let's explore the science of why this is so critical. The anatomy of the penis is a marvel of biological engineering. It's not a solid muscle. Instead, it's composed of delicate sponge-like erectile tissues, specifically the corpora cavernosa and the corpus spongiosum. These tissues are filled with a complex network of tiny, intricate blood vessels. It's the healthy flow of blood into these vessels that allows for a firm erection. Surrounding and running through these tissues is an equally complex network of thousands of microscopic nerve endings. These nerves are responsible for transmitting the sensations of pleasure to your brain. Now, as we age, the walls of these blood vessels can lose some of their elasticity. The nerve endings can become slightly less sensitive. The tissues themselves become more delicate. When you apply aggressive squeezing, bending, or an overly vigorous motion, you are putting immense undue stress on this entire delicate system. Think about it. Squeezing too hard can physically compress those tiny blood vessels, restricting the very blood flow that is essential for a healthy response. It can bruise the erectile tissues, leading to soreness and discomfort that can last for days. And perhaps most importantly, that excessive pressure can damage the nerve endings themselves. This is known as nerve compression or neuropraxia. It can lead to a lingering numbness, a dulling of sensation that is the exact opposite of what you want. And this isn't just a theoretical risk. Clinical observations in urology, documented in patient case files across the country, consistently show that this kind of aggressive technique can lead directly to penile bruising, discomfort, and in some cases, a long-term and very frustrating reduction in sensitivity. You are, quite literally, training your body not to feel pleasure. The brain starts to associate the experience with discomfort instead of enjoyment. It's a cycle that can be difficult to reverse if it's not addressed. Here's an analogy that might help make this clear. Imagine you have a beautiful, finely crafted acoustic guitar, a delicate instrument. Now imagine trying to play that guitar with a heavy-handed hammer. You might make a loud noise, but you won't make beautiful music. You'll just dent the wood, break the strings, and destroy the very thing that was designed to create pleasure. Your body after 60 is like that delicate guitar. It responds to a thoughtful, nuanced touch, not to brute force. The goal is to make music, not just noise. So, what is the safe and far more pleasurable alternative? The solution is to consciously shift your entire focus away from force and onto sensation. This requires patience and mindfulness. I want you to explore gentle, rhythmic motions. I want you to slow down. Slowing down is not a sign of weakness. It is a sign of control and confidence. Pay close, careful attention to what actually feels good now, in the body you have today, not the body you remember from 30 years ago. As we age, what feels pleasurable can definitely shift. Be open to adapting your technique. Explore different types of touch, different patterns, and different rhythms. And here is the most important piece of medical advice I can give you in this section. Listen to your body. Your body is sending you clear signals all the time. If anything hurts, if anything feels off or uncomfortable or just wrong, that is your body's stop sign. Heed it immediately. Pain is never part of the equation for healthy pleasure. I had a client, let's call him David, a 72-year-old former construction worker. a man who had spent his entire life working with his hands, priding himself on his strength and toughness. He came to me because, in his words, things just felt numb. He was frustrated and confused. During our talk, it became clear he was still using the same forceful technique he'd used his whole life. He thought he had to be tough in everything he did. It took some convincing, but I encouraged him to try a completely different approach, to be gentle, to be mindful, to focus on sensation instead of the end goal. A few weeks later, he came back to my office, and he was a different man. He had a smile on his face. He told me that by learning to be gentle, he had rediscovered a level of sensation, a depth of pleasure, that he honestly thought he had lost forever. And here you can see the powerful synergy at play. Proper lubrication, which we just discussed, is what makes a gentle technique possible. It eliminates the friction, allowing you to explore sensation without causing discomfort. The two concepts work together perfectly. If this idea, this shift from force to gentle sensation, is an aha moment for you, I want you to go down to the comments right now and just type the word gentle. It's a way of making a small commitment to yourself, a promise to treat your body with the care and respect it deserves. All right. We've covered the importance of lubrication to prevent injury and the necessity of a gentle technique to preserve sensation. Now we come to our third and final mistake, and this one is a true blind spot. It's a mistake that many men, honestly, don't even consider to be a mistake at all. But from a urological standpoint, especially for men over 60, it is incredibly important. The third mistake is neglecting proper hygiene immediately after ejaculation. Now, I can almost hear what some of you might be thinking. Really, Doc? Hygiene? That seems so minor. And I understand that initial reaction. For most of your life, the post-session routine was probably pretty simple. You finish, maybe you wipe with a tissue, you get dressed, and you move on with your day. There's no second thought about it. And for a younger man whose immune system is at its peak and whose body can fight off minor bacterial challenges without any issue, that routine might have been perfectly fine. But for a man over 60, that routine is no longer just fine. It's a risk. It's an oversight that can lead to uncomfortable, nagging, and sometimes serious health issues that are completely avoidable. What seems like a minor detail, a trivial footnote, can actually have a significant impact on your daily comfort and your overall urological health. It's a classic example of an ounce of prevention being worth a pound of cure. So let's break down the science of why this simple step becomes so crucial as we age. Seminal fluid is an organic material, and like any organic material, when it's left in a warm, moist environment, it begins to break down. This process creates a perfect breeding ground for bacteria. Your genital area, especially if you are uncircumcised, is already a warm and moist environment. When you add residual fluids to that mix and leave them there for an extended period, you are quite literally rolling out the welcome mat for bacteria to thrive and multiply. Now, for men who are in perfect health, the body might be able to handle this. But many men over 60 have underlying health conditions that can make them significantly more susceptible to infections. Let's consider two very common examples. First, an enlarged prostate, or benign prostatic hyperplasia. BPH. This is an extremely common condition in older men. When the prostate is enlarged, it can press on the urethra and prevent the bladder from emptying. This means a small amount of urine can remain in the bladder, creating a stagnant pool where bacteria can grow. If you then introduce external bacteria from poor hygiene into the urethra, you dramatically increase the risk of that bacteria traveling up into the bladder and causing a very painful urinary tract infection, or UTI. Second, let's consider diabetes. Many men over 60 are living with type 2 diabetes. One of the common side effects of uncontrolled blood sugar is a weakened immune system. The body's ability to fight off infections is compromised. Furthermore, bacteria and yeast feed on sugar. If there are traces of sugar in your urine or sweat, it makes the genital area an even more hospitable place for these microbes to grow. A simple case of skin irritation can quickly escalate into a more serious infection for a man with diabetes. This is not about scare tactics, it's about understanding risk factors. The official guidelines from the Centers for Disease Control and Prevention, the CDC, consistently emphasize the importance of proper genital hygiene as a frontline defense in preventing a wide range of infections. This is standard, fundamental medical advice. It just becomes exponentially more critical as our body's natural defenses and conditions change with age. Let's use a very simple analogy. Think about your kitchen. If you spill a little bit of food on your kitchen counter, it's not a big deal. But what happens if you just leave it there? You don't wipe it up. You let it sit there overnight. The next morning, it's sticky. It's starting to smell, and it has attracted all sorts of unwanted bacteria. You've created a small but messy problem. Now, if you had just taken 30 seconds to wipe it up with a warm, soapy cloth right after it happened, there would be no problem at all. Proper hygiene is that simple cleanup. It prevents a minor, everyday occurrence from turning into a major issue later on. So, what is the correct, safe, and effective routine? I'm going to make this incredibly simple for you. The routine involves 2 easy steps. Step 1. Immediately after you are finished, or as soon as is practical, wash your penis and the entire surrounding genital area with warm water. Not hot, just warm. The water itself will do most of the work, rinsing away any residual fluids. Step 2. If you choose to use a cleanser, and it's a good idea to do so, it is crucial that you pick the right kind. Do not use a harsh deodorant, bar soap, or an aggressive body wash full of fragrances and chemicals. These can strip the natural protective oils from your skin, causing dryness, irritation, and making the problem even worse. Instead, choose a mild, fragrance-free, pH-balanced cleanser specifically designed for sensitive skin. You can often find these in the baby care aisle, or labeled as a gentle skin cleanser. After washing, pat the area completely dry with a clean, soft towel. Don't rub aggressively, just a gentle pat dry. That's it. The whole process takes less than a minute. I had a patient, a gentleman in his late 60s, who came to me complaining of recurring redness, itching, and general irritation for months. He had tried over-the-counter creams, powders, everything he could think of. Nothing worked. It was driving him crazy. During our consultation, when I asked about his hygiene habits, he admitted he didn't really have a routine. We didn't change anything else. No new medications, no expensive creams. We simply implemented this exact 2-step washing routine. He came back for a follow-up a few weeks later. The problem that had plagued him for months was gone. Completely resolved. He said he felt foolish for not realizing it sooner, but I told him it's not foolish. It's just something that nobody ever talks about. And that is the final piece of the synergy. You use proper lubrication to protect the tissue from the inside. You use a gentle technique to protect it from pressure. And you use proper hygiene to protect it from external threats. These 3 simple habits work together as a complete system to ensure your comfort, your health, and your peace of mind. All right, gentlemen, let's bring it all home. We've covered a lot of important ground today, but it all comes down to 3 fundamental keys for a safe, comfortable, and healthy sexual life after 60. 1. Always use a quality lubricant to protect your body's delicate tissues. 2. Consciously shift your focus from force to gentle sensation, preserving nerve health and increasing pleasure. And 3. Always make post-session hygiene an immediate priority to prevent irritation and infection. But knowledge without action is just information. So here is your simple 3-step action plan for this week. Your doctor's prescription, if you will. First, go online or to a local pharmacy and purchase a bottle of quality water-based or silicone-based lubricant. Think of it as a small $10 investment in your long-term health. Second, the very next time you are intimate with yourself, make a conscious effort to be as gentle as possible. Your only goal should be to pay attention to sensation. And third, Make the post-session cleanup as automatic and non-negotiable as washing your hands after using the restroom. Now, I know exactly what some of you might be thinking. Doc, it feels awkward to buy lubricant. Or perhaps, I'm too old to change a habit of 50 years. To that, I say this. Remember, you can buy these products discreetly online, delivered right to your door. No one needs to know. And more importantly, it is never, ever too late to make a small choice that protects your health and your independence. And please remember this. This is about so much more than just an act of pleasure. This is about taking active control of your body. It's about respecting the man you are today and ensuring you have the vitality and the confidence to live life on your own terms, without unnecessary pain or discomfort. If you are ready to take charge of your health today, I invite you to join our growing community of men who are doing just that. Go ahead and hit that subscribe button so you never miss our practical, science-based health guides. And more importantly, go down to the comments right now and write 2 simple words. Day 1. This isn't for me. This is your public commitment to yourself, a declaration that today is the day you start. Thank you for trusting me with your time today. In my very next video, we're going to tackle another huge and often misunderstood topic. Is low libido after 60 normal, and what can you actually do about it? You will not want to miss that discussion. Until then, stay informed and take charge of your health.